Hi, I'm John Payne. Welcome to my 8th annual Senior Health Fair at the Hummelstown Fire Department. Today we have over 60 vendors offering services from retirement to social services to banking to your own personal needs. Vendors that are giving screenings for blood pressure, cholesterol. Let's hear from some of those vendors and some of the people that are using those services.
I'm here today with students from HAC's Dental Hygiene Program. Can you tell us just what your role and your mission is here today?
Well, we came out into the community to provide free oral cancer screenings to the community and just check for any decay and make sure everything looks good.
And can you tell us a little bit about the program?
It's a 2-year program once you get in, and it's very in-depth. We have the clinic right on campus, so we see patients starting in the first year. We do oral cancer screenings there as well, and then the cleanings and anything the patient might need.
And generally, have the crowds been pretty good here today?
Yeah, I was here last year, and we didn't give out as many oral cancer screenings, so it's nice to see everyone sitting down so we can take a look.
We try to educate about our main focus is distraction burglaries, and senior citizens are particularly vulnerable to that because they're targeted by the bad guys. And this is a type of crime where bad guy one comes up to the house and tries to separate the senior citizen from their home under some type of trick, like whether they pretend to be a utility worker or a landscaper or whatever, so they get the senior citizen from the home, and then bad guy number two goes into the home and commits a crime. We have a lot of problems with that in the senior citizen community, so if we can come out here and do some education and prevention, it's good for the community in the long run.
Certainly, criminals tend to be one step ahead. Is there a certain crime that you're seeing, something new that you're seeing that maybe you hadn't seen in the past, or that's a little more prevalent nowadays than used to be?
Just in general, it would have to be all the crime through electronics and computer-facilitated crimes, fraud, credit card fraud, identity theft. That's the main focus that we're getting now. It used to be that the bad guy had to go out into the community and commit the crime, and now they can do it from their house or Starbucks cafe or whatever, and they never have to actually leave. They just need access to the internet.
Do you have any tips for people on how to prevent that?
Secure your identity, shred your documents, be cautious of who you give your information to, and continuously check up with your credit report, monitor yourself on the internet.
And then finally, can you tell us a little bit about Derry Township Police, how many officers you have, and the cycle of your year, how it works a little bit?
Our full complement is 39 officers. During the winter months, that's enough. During the summer months, it's not nearly enough. We have, I think it's almost 5 million tourists come here every year, so the Hershey-Hummelstown area is inundated with people all summer long through special events, etc., and we're pretty busy.
We're here today to provide certain immunizations for those folks whose insurance or they don't have insurance that wouldn't cover the vaccine for them. So there are some eligibility criteria that we have. We have a shingles shot here today, the tetanus shot, a pneumonia shot, and some leftover flu shot that it's still safe to get if you haven't had it for this season.
Those type of things that you're vaccinating for and doing the immunizations for, how are those things really potentially detrimental to a senior if they would pick those things up?
Shingles is very devastating. It's very painful, and the pain can last for years. And depending where it affects you on your body, can be, if it goes in your eyes, you can lose your vision. I can tell you, I myself had shingles at 21 years of age, I won't say how many years ago, but back then there was no antiviral medicine. You just lived with the pain. And I had chest pain for 2 years after I healed. But if it goes to the eye, you can lose your vision. It's very, 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 very painful.
Is that a vaccination that you get one time only?
One time only. And the recommendations have since changed. ACIP, it was recommended for 60 and older. About 2 months ago, those recommendations were changed to 50 and older. So that really opens it up for a lot of people.
And then you mentioned also one for pneumonia. Is that another one that is just a one-time shot?
Pneumonia in different scenarios may or may not be a one-time dose. Recommendations are if you got your first dose before you were age 65, depending on some health issues, you would need to get it again after you turn 65, and 5 years have to be between each shot. But it depends. There's a lot of different scenarios with that one.
And are you giving immunizations to a lot of people today? Have the crowd's been good?
The crowd has been great. I think we've probably already done maybe 40 or 50 people in this first hour. You can contact the Department of Health at 1-877-PA-HEALTH. That will get you to a call center, and they'll get you out to your proper county, and then each county will just give you that information and do the screening.
Hi, I'm Grace Vasquez with Country Meadows at Home. I'm the Director of Client Services. And Country Meadows at Home is a non-medical, private duty company that provides services to our clients in the comfort of their home.
Can you give an idea of the range of services that you provide?
Sure. The range of services we provide are personal care, homemaker services, transportation escort services, and also companionship services.
So if someone has a parent or if they themselves are someone that wants to age in place and age at home, you would be the perfect fit for them.
Absolutely. One of the wonderful things about private duty service and home care in general is that we want our clients to maintain their independence in the comfort of their home. We want our elderly to maintain that independence. Home is home, and it's a wonderful place to be, and if we can help provide that service to enable them to maintain that independence at home, that's what we're here for.
I'm sure that has a benefit to the person themselves, both from a mental health standpoint and just a happiness standpoint. But I would imagine it also has an economic benefit as well.
It does. It's less costly than an actual retirement community. However, there's some folks that do need a retirement community, and that's where Country Meadows comes in. Country Meadows of Hershey, we have Country Meadows of West Shore, and so that's where the retirement communities come in. Some folks do not want to stay at their home anymore. They want to be in a retirement community where they can socialize with others in their age group. So that's what that enables them to do.
And how would folks contact you if they want more information?
They would contact us at 888-754-2220.
I'm Bill Deckent. I picked up some information about my general health, blood pressure, bones and joints and so forth. One of the things I saw was, there were two places I saw blood pressure screening, which is important for older people to keep monitor their blood pressure. I saw a thing about eyes, and dental health, just general health.
Would you recommend people coming out next year for this if they didn't make it this year?
Yeah, I think so. It gives you good general information. I think that's what it's geared to.
I see there's a lot of state agents here which are very helpful, because one of them is in regard to scamming, and sure enough, this past week there was an attempt to scam me on my computer, of all things.
And did you fall for it, or were you alert?
Very fortunate. I did not give them any information and checked it out with my regular agency, and they really said it was a scam.
And I see by your hat that you're a veteran. So is there any information here for veteran services that you might be looking at?
I haven't been upstairs as yet, but over the years, yes, there are different agencies here represent the veterans. It's very helpful. And
any information that you want to say to your fellow veterans of things they might want to look into and find out more about?
Well, basically, at a certain point in your life, it's mostly health care, of course, the health care related things. And I do get a lot of information from the different veteran groups with regard to that. The timing is very difficult. Of course, the VA is really overwhelming it, so we have to depend on our reps to continue to fund that program for veterans that really need the help. As up this point, I've don't have to use any of their funding, fortunately.
And would you suggest to other people to come out next year if they didn't make it this year?
Absolutely. It's a great exposure of all the different agencies for anybody that in regards to your age level. You know, most people think it's mostly for the elderly, and I would say not. There's a lot of agencies here that represent everybody.
I hope you enjoyed this month's V-Clip on the Senior Health Expo. In case you missed this year's event, check my website, reppayne.com, for next year's dates and times. Thank you again. I'm John Payne.